Welcome to the question and answer session. Test question logic will help you read and interpret test questions correctly, eliminate distractors, and use critical thinking. Follow these steps as you attempt to answer the questions. First, identify the critical elements in a question, such as keywords, who is the client, what is the issue or problem in the question, and lastly, what is the STEM asking. All questions have 4 options, of which 3 are distractors. It is often easy to eliminate 2 distractors. However, the remaining options often appear equally correct. Next, apply test-taking strategies such as identifying a global response, looking for an options with similar distractors, and lastly, similar words. Next, apply nursing guidelines, Maslow's hierarchy of needs, nursing process, communication theory, and teaching learning theory. If you will follow these strategies and guidelines, you will find answering the questions much easier.
So if you look at the screen, you first will see a chart. And remember that in the changes that have occurred, you're going to be seeing more charts and graphs. So you need to kind of train yourself to be looking at them and looking at what are those things that are important on these charts and graphs so that you can come up with the correct answer. And now let's go on to the question. The nurse reviews the medication sheet for a new admission with pneumonia and asthma exacerbation. Which of the transcribed medication orders needs further clarification by the nurse before it can safely be given to the client? Now this is a great question because it has several elements in it. First of all, this is a false STEM response. It is a false response that we're looking for. It's looking at what needs further clarification. So one of the key points here then, or the issue is, what needs further clarification? And of course we're looking at which of the medications need further clarification. And so it is a safety issue. These types of questions because safety is overriding. If you remember when we looked at test-taking strategies, safety and asepsis are the 2 overriding issues. So let's look at the first response. It is number 1, is it Kevzol? 2, aminophylline. 3, Proventil. Or 4, Tylenol. Now, one of the other issues that I didn't point out to you when we were looking at that is that this client has an allergy to penicillin and aspirin. So when we look at safety, we know that when a nurse is going to administer medication, there are several things they have to do. One of the first is to check for any drug sensitivities or allergies. If a client has an allergy to aspirin, it is okay to give them Tylenol because they're not the same family of drug. So Tylenol, number 4, can be eliminated because we know that the allergy to aspirin does not affect the ability to give them Tylenol. That leaves us with aminophylline, Proventil, and Kevzol. If the client's allergies are listing a penicillin-based, then we need to look at which of those drugs are in the penicillin family. Proventil is not in the penicillin family because it is a bronchodilator. Aminophylline also falls under that category as well. Therefore, by process of elimination, we look at the drug Kevzol. And remember, there is a sensitivity, a cross-sensitivity between Kevzol and those individuals who are allergic or who have a sensitivity to penicillin. Therefore, before the nurse were to give that drug, they would have to make sure that they check to see whether the client has ever taken a cephalosporin before and whether they've ever had any adverse reaction to that. If not, we may still give the drug and monitor them for allergic response. The next question that you're going to see on your screen, first you're going to see a picture again. If you remember earlier, when we talked about chest tubes, we talked about, we gave you a picture of the chest tube and the chambers. Well, this is the very same picture. You're going to look at it again because it really illustrates this question as well. So take a look at those chambers, and they are marked. If you'll notice, they're marked as to which chamber is what. It tells you which one is the water seal, it tells you which one is the drainage system, and so forth. Now, if you got that picture in your mind, let's go forward and read the question. A client with a gunshot wound to the chest returns from the operating room with a chest tube connected to a chest drainage system, as depicted in that diagram that you just saw. The nurse assessing the client expects to see fluctuation with each respiration in chambers. And remember what we just talked about, that in fact we know that there are two chambers that have fluid in them. And if we look at chamber A, it is the suction control chamber. It is clearly marked as a suction control chamber. However, if you remember what we just talked about, that is not related to respiration. That's related to the control, the fluid control, and the control of the vacuum seal, or the vacuum, that will cause the fluctuation to be continuously bubbling. If you look at the chamber C, it represents the drainage collection. You wouldn't see bubbling in the drainage collection, but rather you would see an accumulation of either blood or fluid in that chamber. So the answer will, by process of elimination, would be B, because B is the water seal drainage chamber. Now, I want to just talk for 1 second about the number 4, which says A and B. Remember, again, chamber A is only the suction control chamber. So you'd see continuous bubbling unrelated to respiration. Therefore, the only answer it could be is number 2, chamber B. The next question you'll see on your screen has to do with COPD. So let's take a look at this one. A client with chronic obstructive pulmonary disease, or COPD, is to be discharged on theophylline, or Theodure. The nurse performs the discharge teaching about the potential side effects of this drug. It is most important for the nurse to emphasize that the client should report to the primary caregiver if they experience 1, a loss of desire to eat, 2, a pounding sensation in the chest, 3, a loss of sleep, or 4, frequent loose stools. Now, there are 2 things that you need to look at when you are going to employ strategies. Certainly, again, there is no substitute for knowledge. So if you know this question, or you know about theophylline or Theodure, then the knowledge will get you through this question. But if you don't, or you're unsure, there are some key words. Remember that the issue is theophylline and discharge teaching. Those are the 2 key issues. The other key word here is most important. And most important means that although the others may also be an important part of what you teach them, what do they absolutely need to know to be safe when they go home and monitor their progress? Remember what happens when you give theophylline. One of the things that happens is it is a bronchodilator, but it also may sometimes cause jittering. And the clients will say they feel like they're shaking. The other thing that happens, though, because it bronchodilates, it causes an increase in blood pressure and so forth. So whenever you look at a client who has that, let's take a look at the number 1. Number 1 says loss of desire to eat. Although anorexia is a side effect of theophylline, there is another side effect that has more potential to injure the patient. Remember what we talked about. Safety is overriding. So although anorexia, or loss of the desire to eat, is important, it's not as important as one of the other selections. If you were to have chosen frequent loose stools, you know that that also is a side effect of theophylline. However, there is another one that is a greater threat to the client's overall well-being than to have diarrhea. If you look at number 3, insomnia, insomnia also is a side effect of theophylline, but again, that it is not as great a risk as the obvious one, which we've left out, and that is number 2. If the client is developing pounding sensation in their chest, that is one that means that the client may be having cardiac arrhythmias, and a cardiac arrhythmia is life-threatening. You can argue certainly that a diarrhea might also be. However, of the 2, you have to critically think and prioritize which of those is the most life-threatening. Is it a cardiac arrhythmia? Is it diarrhea? Is it insomnia? Or is it anorexia? So based on on those parameters, cardiac arrhythmia is the one that is the most life-threatening.